Hey everyone, my name is Jason Nagle. I'm a third-year medical student at the University of Michigan. I'm here today to talk to you about the different types of medical schools in the United States. You may have noticed before that some doctors have a MD after their name, while other doctors have a DO after their name. What do these letters mean? To answer that question, we'll learn about the two main types of medical education in our country, allopathic and osteopathic. The letters MD after a doctor's name signifies that they went to an allopathic medical school and received a doctorate of medicine degree. The majority of physicians and medical schools in our country are allopathic schools. There are currently 141 allopathic schools in the United States. The letters DO after a physician's name signifies that they went to an osteopathic medical school and received a doctorate in osteopathic medicine. There are currently 29 osteopathic medical schools in the United States. So now that you know what those letters mean, what's the difference between an MD and a DO? To be honest, not that much. Both MDs and DOs are full practicing physicians in all different types of specialties, from neurosurgery to family medicine, OBGYN, dermatology, and everything in between. In fact, there are many more similarities between osteopathic and allopathic schools than there are differences. Let's take a moment to look at some of the similarities that the application process for each of these schools entail. Whether you're applying to an osteopathic or an allopathic medical school, you still need to take the MCAT, gather letters of recommendation, take prerequisite courses like organic chemistry, biology, general chemistry, and physics, and you need to apply through a standardized application service such as the AMCAS for allopathic schools or the AACOMAS for osteopathic schools. The main differences between osteopathic and allopathic medical education occurs during medical school. As an allopathic student, I know that my osteopathic colleagues are learning much of the same anatomy, physiology, biochemistry, and pathology that I am. In addition, they learn some specific osteopathic techniques. To hear more about this, I asked my friend Tarana to talk to us.
Hi, my name is Tarana Nagle and I'm a third-year medical student at Michigan State University College of Osteopathic Medicine. The question that I'm here to address today is what exactly does it mean to be a doctor of osteopathy or a DO? The best way to address this question is to talk a little bit about our philosophy. An overlying theme in our philosophy is healing with the power of touch. So what does that exactly mean? DO schools really have a big emphasis in education in anatomy, particularly in neuromusculoskeletal anatomy. We then take this education and we apply it to a certain type of medicine called OMM, or osteopathic manipulative medicine. This is a type of medicine that really teaches us how to use our hands to manipulate patients in order to treat a number of conditions. Some of these conditions include tension headache, back or pelvic pain, which is very common, or it can even be used in the hospitals to treat post-operative patients that have conditions such as lymphedema. OMM is taught to osteopathic medical students in their formal education in medical school, but is also available for MD students that are in their rotations or even physicians once they get into the hospitals, and can be taught to them by other physicians, or they can learn it on their own and apply it as a tool in managing their patients in the hospitals or in the clinics.
So as you've heard, both MDs and DOs are very qualified physicians who just want to make sure that their patients receive the best care possible. In the long run, it probably doesn't matter what initials you have after your name, whether DO or MD, as long as you study hard and take time to really care about your patient's health. With that said, I should mention that there are some differences in the average GPA and MCAT scores for DO and MD students. Let's take a quick look at this. As you can see, on average, MD students tend to have a higher GPA during their undergraduate studies and a higher MCAT score. So what does this difference mean? We don't really know. We know that it does not mean that an MD student is smarter than a DO student. And we know it does not mean that a DO student didn't work as hard as an MD student. Remember, the number one priority for any physician, whether they're an MD or a DO, is patient care. So in the long run, it doesn't matter what letters you have after your name. I hope this has helped clear up any questions you might have about osteopathic versus allopathic medical schools in the United States. If you have any more questions, please post them in our forums on the website. That's what they're there for, right? Until next time, I'm Jason Nagle. It's been fun talking to you.